we're here on time. We're going to get started. We've got a lot of conflicts from our members after crossover day. Several committees going that people are trying to do both and trying to get bills out of the House. So we're going to get started. Commissioner, welcome, and appreciate you guys being here. I'm going to turn your mic on, and y'all remind me if somebody's in the back, if the mics aren't working right, y'all let me know, okay? The floor is yours, Commissioner.
Thank you, Mr. Chairman, and it's an honor to be here today with you all. Before we get started, I know that we want to focus on the House ads that came in, but I really feel it's important with this being recognition of Strong Women's Month. I have Lisa here and Mario Ellis here, our Chief of Staff, and Kelly Richards, and I just want to recognize the work that they do for the department. They are fearless, strong, independent people who do incredible work for the state of Georgia, and we are lucky to have all of them. And so thank you, all three, very much for what you do for us. With that, I will turn it over to Lisa to walk through the House ads, and then we will be prepared to answer any questions that you have or any members of the committee. Thank you all for coming in today, and really appreciate it, and great to see all of you. So thank you very much.
Well, before we get started, we appreciate the work that you and your team are doing, not just with the normal routine stuff that you do every day, but also the COVID response. We know y'all been on the front lines dealing with that, and especially with that personnel supplementation throughout the state to a lot of the hospitals and nursing homes that were overwhelmed and needed personnel. So want to thank you guys for all of the work you've done for Georgia. So make sure you share that with your team that's not here today. Lisa, your mic is live, so you've got the floor.
We prepared a presentation, but I'm going to walk through the Senate document to reference just the House changes as it relate to the recommendations from the House compared to our recommendations for FY 2022. The first of those items is in Departmental Administration Program and Support, and that item is 84.5 for an increase of funds for 2 senior leadership positions to support the department's increasing workload. The House added $556,456 for that, and our strategy would be to strengthen our Medicaid section in terms of our contractual compliance, in terms of the monitoring of our CMO contracts. Those, in terms of the monitoring those contracts, managing those contracts, and I would say quality that is included within those contracts for those CMOs that we have for the department. The next item that's a change for the department as it relates to the agency recommendation, the governor's rec versus the House recommendation, is healthcare access and improvement. An 87.1, the elimination of one-time startup funds for federally qualified health centers of $500,000. There's a reduction there. And 87.2 is the increase of 2 federally qualified health center startup grants for Jeff Davis in Marion County. The reduction is just to reduce what was put in for the appropriation to establish just two additional funding opportunities for those 2 startup grants for those 2 FQHCs. The next item is in Medicaid, Age, Blind, and Disabled. That's our benefits program for the Department of Community Health. The first of those changes is 90.4, increased funds to reflect the loss of enhanced federal Medicaid assistance percentage during the COVID-19 public health pandemic.
Lisa, I'm sorry to interrupt, but the 88.2, did you skip over that?
.2.
I think that's a House ad.
Okay, sure. That House ad for healthcare facility regulation, 88.2, is increased funds to support strategic measures for stabilizing staffing in the nursing home program. That House added $7,454,466. Actually, this ad is actually, completes our initial proposal that we submitted to OPB. We submitted to OPB a proposal to help stabilize the nursing home staff within the healthcare facility regulation program. And as a result of that, we were recommended by the governor's recommendation 4.8, and that was for contractual services. But the additional amount the House put in actually fully funds that proposal that we had originally submitted to OPB.
Yep, thank you.
And I'm sorry for skipping that one. The next item is Medicaid, age, blind, and disabled. Item 90.4 is the increased funds to reflect the loss of enhanced Fmap, federal medical assistance percentage, during the COVID-19 public health emergency. We actually had that recommendation at $81,809,247 with a reduction in the federal. The House adjusted that to, as a result of reflecting the savings for the temporary 6.2 federal medical assistance percentage increase through September 30th, 2021. And the House recommended $7,162,502. And to our knowledge, that is that it will be extended to September, but we haven't officially gotten that documentation. The next item is 90.8, increased funds for a 2% rate increase for skilled nursing centers. The House recommendation is $11,932,550 in state funds with a total appropriation of $36,050,000 for a percentage increase for long-term care facilities. We did not originally have that proposal. This is a recommendation just initiated through the House. The next item is 90.9. Increased funds for skilled nursing centers to update the general and professional liability property insurance and property tax pass-through rate components to current cost. The House recommendation is $3,470,204 with a total appropriation of $10,484,000. That includes federal funding. The next item is 90.10, increased funds for a 10% rate increase for home and community-based service providers, with a recommendation from the House and state funds of $25,328,540, with a total recommendation of $76,521,261. And this will be for all of our home and community-based waiver services. The next item is in Medicaid. Also, our benefits program, Medicaid, low-income Medicaid, which we refer to as LIM. The first of those changes is 91.2, similar to the one we went through in age, blind, and disabled. The increase in funds to reflect the loss of the enhanced federal medical assistance percentage during the COVID-19 public health emergency. The House made an adjustment to reflect the additional enhanced Fmap savings of $47,977,836 for the first quarter of state fiscal year 2022. The next item in low-income Medicaid is increased funds to increase 18 select primary care and OBGYN codes for 2022 Medicare levels. That's a House recommendation that wasn't originally part of the recommendation for the agency. And that increase is, in state dollars, it's for $7,097,618 with a total appropriation of $21,442,954, which includes our federal share. The next item is Peach Care, 92.2, which is also related to the loss of enhanced Fmap during the COVID-19 public health emergency. Once again, the House actually reflect savings from that enhanced Fmap for the period of first quarters, fiscal year 2022. And that amount is $4,047,155. And the last item for the Department of Community Health is in the State Health Benefit Program, 93.1. And it's for a pilot program for a drug deactivation system that provides a safe disposal of unused prescription and over-the-counter medication. And that recommendation from the House is $500,000. Page 10, 93.1.
So that's your last one.
That
right?
was the last
And
item
just
for the Department of
But
Community.
before anybody else has to ask, do you have any information about that program, or or it's just added in the House? So do y'all have y'all vetted that in any formal way, or?
We had met with the provider. We've had a presentation that was done to the executive leadership team of the department, and it was an appealing initiative, and the House added it.
Okay.
But we have met with the provider.
Okay. I'm going to open it up for questions. Do you have any more presentation for anything? And I think
No, sir.
we'll see where the committee leads us, and I've got a handful myself, but I'm going to see if somebody else has them first. So. Senator Kirkpatrick.
Yeah, I have a few questions. Starting with the thing that you were questioning about the pilot program, I would hope that that is generic enough that we are not locking ourselves into one system, because there are multiple ways to dispose of dangerous drugs. And I would hate to just have that specific to one vendor. So I hope that is a process that can incorporate potentially different ways of doing that.
Yes, ma'am. We had only heard from one vendor, and that was maybe 4 weeks ago. Pilot projects are interesting. I think the other part that it's specifically designated for SHBP is another little bit of a interesting twist to it. But we hear your point, and certainly will follow whatever the General Assembly and the governor directs us to do on that. But I understand your point.
I'd be happy to talk more to you about that later.
Great.
And
And
then,
let me interrupt, okay, if you, Senator Kirkpatrick, just because we do have several new members of this committee, and the amended budget had very little in it this year. We didn't have to do a whole lot, to be honest. So, but I do want the members to understand that any area whether it's a change in the House or an area of interest for the members, if y'all will get me what your concerns are, recommendations are in writing. We have to present our plan on Friday, so there's not a lot of turnaround, but any input that you want to have will be taken seriously in the Green Door process. So don't think you're wasting your time if there's something that you're concerned about. So just want to make sure everybody understands that, okay?
could
All
I
right.
keep
Now,
going?
You have the floor.
My next question was 91.10, where you increased 18 codes to OB and primary care doctors. I know there was a window that opened up for one time for providers to apply for enhanced payment, and I just wondered if this changes any of that, if that opens it up anymore, or if it's just the providers that are already in the system.
Blake, you want to, that's the attestation issue.
Yes. Senator, you're correct, and that period for provider attestation stems out of the Affordable Care Act's primary care rate increase that was put into place, I believe, in 2012 and 13. And then the General Assembly has subsequently taken several actions to extend those primary care rate increases and add to them in some respects. Generally speaking, aside from, I believe, 2015, there was a period that was open for providers who didn't attest in the first round to be able to do that. But I don't believe under what's contemplated here, it would reopen attestation for providers who've not attested.
Okay, thanks. I have one more.
Our preference ultimately would be to do away with attestation.
Right.
Yes.
That would be the cleanest, absolute best approach to have a level playing field again.
Okay. I have one more, if you don't mind.
I don't mind at all.
Okay, the only other one is, I'm intrigued by 88.2, the strategic measures for stabilizing staffing in the nursing home program. I'd just be interested in a little bit more detail about the plans for that.
Sure. You want to start or you want me to? You go ahead.
You know, only thing I was going to say, Commissioner, in terms of, there was a full plan in the amended year and for the base year to stabilize healthcare facility regulation in terms of an approach where they were going to regionalize the surveyors. And most of that plan included hiring new employees, some, I call it geographical differentials for surveyors that work in certain areas. And we have that plan, and we can provide that because it has been shared with OPB, it's been shared with the House, and I think we shared it with Melanie, but we can share that plan where you can see the whole entire plan and description that walked.
Yeah, we have that, and I'll get Keith to get that sent to all of y'all so you can see.
Mr. Chairman, if I may.
Yes.
Just add one.
Mr. Commissioner.
Thank you, sir. If you remember 4 years ago, we came to you all with an urgent request to increase funding. And that helped for about 18 months. And then we started to see competition, the economy turned around, and we started losing nurses again. What has happened over the last 12 to 18 months has been unprecedented in long-term care facility oversight. We've read about it in the news. We've lived it day in and day out during the last 11 months in particular. HR and HFRD, Health Facilities Regulation, did a comprehensive review of what we thought it would take to bolster that program up. It's been the one area throughout my time at DCH from day one that has had a real challenge with staffing. We've lost staff to both illness, we've lost staff to go to contract agencies, and so this one is huge. And your consideration for it would be greatly, greatly appreciated. I'm done.
That was easy. Any other questions from committee members? I'm not seeing anybody trying to catch my eye, so I'm going to start mine, and y'all interrupt me if you get bored. It won't change anything, but you can interrupt me. Commissioner, on the 84.5, the senior leadership positions, you spoke, or Lisa did, a little bit on what those folks would do. I know we've had some conversations about your senior leadership team and how small it is, considering y'all are managing about $3 billion of state dollars. So, you know, one of the areas that I think is important to the Senate is trying to increase the value-based purchasing or quality metric in the contracting, and I'm hopeful that if we are able to provide some extra support, that would allow the bandwidth for you guys to implement some of those more sophisticated oversight programs, so we can see some improvement in our quality and in our CMO delivery system, and actually start some work on doing that in the ABD. So would you care to comment on that?
I would echo exactly what you just said. You've captured the internal discussions that we've had very nicely. We talked about a variety of different positions, but where we landed was exactly with what you just conveyed based on Lisa's input from earlier. We believe, as nice as it would be to have a little bit larger executive leadership team to help oversee the department, we felt that this area would be a better use of those dollars in regards to concrete outcomes. We certainly would love to have, 50 more positions, the strategic officer, all those kinds of things. But from a very concrete, with where we see healthcare moving in the future, with exactly what you said, value-based purchasing, how do we incorporate that into potentially new CMO contracts that will be taking effect at the end of 2024, the oversight and the monitoring, the compliance, and the creativity that goes into those contracts, we felt that these would be the best place, that would be the best place for these positions to go for exactly what you said. Okay.
And one thing I want to share with the subcommittee, and I'm going to use, this happens several places in the budget, but on 90.4, the enhanced Fmap, just to make sure all understand, because of this public health emergency, the federal government has increased the amount of matching money that they send to us on our Medicaid claims, and for the ABD, that's estimated to be $81 million through that, I guess, first quarter of our of our 22 budget year. And of course the House moved that down to $7 million, and for those of you that are new here, that basically means they applied those funds somewhere else in their budget, which is not unusual. We do this all the time. One of my concerns with the enhanced Fmap is it is temporary, and if we spend that money in the base, then that means next year we've got to come up with that money. If we spend it on one-time programs, it's a little less stressful for me as a budgeteer, but just want to make sure that everybody, that, like I said, we've got a lot of new members to this committee, and it's taken me, I guess, 7 years now to kind of somewhat feel like I understand some of it. So anyway, just wanted to make sure y'all were aware of that. And is there any guidance that you guys can give us in areas that you think that would be good ways to make sure those extra funds are handled in an appropriate way that will not cause us harm in the long term from a budgetary standpoint? I know that's a loaded question. You don't have to give me an answer.
Only way I can respond, Senator Burke, is that with that reduction, only answer I can give is with that reduction of the 81, it would have restored what we thought was be a return to normal Fmap, but since it's been proposed that savings will be extended until September the 30th, it will be a larger add as it relates to our traditional growth projection to make it whole. Mm-hmm. Yeah, so it would add, increase the either the amended year and the forthcoming FY23 base year, yes.
Yeah, and again, I'm spending a little extra time because we don't have a lot else to do today, and as I said, we've got a lot of new members to this subcommittee. Part of the carrot and stick with that CARES money is we can't remove anybody that's not eligible from Medicaid. Mm-hmm. And so our enrollment is going to be higher, and so we are going to have an increase in cost and related just to the eligible population that we're going to have to serve. So I guess my point is I want us as a committee to be careful and be very, very thoughtful about how we spend those enhanced Fmap dollars.
I'm glad, Mr. Chairman, I'm glad you raised the issue about the eligibility, because when we do go back to doing redeterminations, the catch-up time to do that is going to be pretty significant. And also, there will be a lot of what some people call noise, because there will be people that will have to be removed from those roles down the road once things get back to normal. So just to begin to prepare people for what that's going to look like. The volume of catch-up will be huge, and the volume of people that then are no longer eligible will also be significant, simply because we've not been able to take people off those roles during this time.
On moving forward to the 90.9, which is the skilled nursing center bump, you know, we've had conversations, well, not 90.9, it's the one before that, 90.8, the 2% increase. And again, nursing home funding is very, very complicated, but we base it on what are called cost reports. And we're working off which cost report now? What year?
It's
Current?
2012 for nursing homes, and it's 2013-14 for the change of ownership nursing homes.
Okay, and, you know, one of the things we bounced back and forth in the past is updating that to, you know, a current cost report. And I think you guys have told me that's probably 2019 would be the latest that we actually have data.
Yes, I think it's the 2019 is the most current audited cost report.
Yeah, so if you guys wouldn't mind running those numbers for me and just let me know what this world would look like if that happened. Would there be winners and losers? And if we had losers, what would that delta look like? And I guess following along with Senator Kirkpatrick's concern about 91.1 on that attestation issue, again, if y'all could just kind of look at what that would look like if we did what you suggested, just do away with it, but also if we did open it up again, you know, how much would that cost us if that's something that y'all could look at. Lisa's eyes are wide. That must mean that's a big number, but
It's
I mean,
big,
the
but-
House left us $30 million, you know, of that Fmap money. I mean, you know, we got some money we can play with here, so, exactly. I think my questions are done. Keith, is there something I forgot that you feel like I should have asked? And for anybody that doesn't know Keith, he's our new budget analyst, and we've thrown him in the deep end. So welcome to the team. Bless your heart. Any other questions? We will let these folks get back to their day jobs. And
I apologize that I was in and out. We were having an ATL, a transit break, and they were trying to get a form, so.
no problem. I appreciate your.
I'm sorry that I really missed.
You've always been a very active member of this subcommittee since I've had it, so I appreciate your being here. And we're going to move on. We've got I think should be a short presentation from Ms. Hughes with the Healthcare Workforce Board. It's taken me a long time to get used to calling it that since we changed the name last year.
Thank you very much.
And if you could just focus on the changes that the House made in your budget, but also I'd love, again, because we have some new members, if you kind of do a quick summary of what you do every day. And I'm going to also allow you to put your other hat on and talk about that other group that you represent.
Thank you.
Briefly, because the work you guys do is important, and unfortunately, because your budget's kind of stable, we don't hear from you as much as we should. So I want to thank you for all the work you do to keep Georgia healthy. So, floor is yours.
Thank you, Mr. I usually speak so loud now. Thank you, Mr. Chairman and members of the committee, for inviting me to speak on behalf of the Board of Healthcare Workforce. And our board changes start on 95.100, graduate medical education. So 95.2, 95.1 is Fmap. It's a decrease from 67.30 to 66.85, $245,075. 95.2, I would like to say on behalf of the board and all of the residency training programs in the state, we're so thankful that you are funding the 188 new residency slots in primary care for the residents in Georgia. That's $2.58 million. 95.3 is to coordinate with medical education programs to develop medical education to address the shortage of forensic pathologists. And what we found during COVID was there are not a lot licensed here in Georgia, so this is to start the conversation about that. 95.4 is a House recommendation to increase funding for initial planning for the establishment of graduate medical education program at Southeast Georgia Health Center system. That would be for internal and family medicine in Brunswick, and that's for $180,000. It's program development. The second slide, House recommendations. 96.100 is Mercer School of Medicine is their operating grant. There's changes to that. 96.1, we are increasing the funds for the second year of the 7-year plan for Mercer School of Medicine, their campus in Columbus. So that's 5.5 million. 96.2, increase the funds for medical examiners, forensic pathologists at Mercer School of Medicine. So they've gotten out there and they're requesting $250,000 to get that started. On our summary page, it just shows all of our other programs are budget neutral. The only changes were made to graduate medical education for our slots and Fmap and Mercer's operating grant as well. And I forgot to mention what we do. So the Board of Healthcare Workforce addresses the healthcare workforce needs of Georgia communities. We support the development of medical education programs. We help to increase the number of physicians and healthcare practitioners, such as advanced practice nurses, physician assistants, and dentists practicing in underserved rural areas. We produce reports, we do supply mix and distribution of healthcare providers, and we had a loan repayment program, which we are very proud of, and we have placed over 117 physicians in these rural areas on our loan repayment program.
117.
Mm-hmm.
Could you repeat that again, the numbers, what you just said?
Right, so for the loan repayment program for FY20, we had 117 recipients. We had 48 physicians that went to 31 counties. We had one for, you had a malpractice grant for physicians in rural areas, and we were able to award one for that. 15 dentists went to 14 counties. Advanced practice registered nurses were 25 in 16 counties, and PA, same thing, 25 for 16 counties. The program is so popular that we turn people away every year. We turned away 60 advanced practice registered nurses this year. There was so many people that applied for that lived in a rural area. So it's a very popular program that we're proud of.
Okay, Senator Kirkpatrick.
The loud mouth, sorry about that, Mr. Chairman. First of all, thank you so much, especially for recognizing that graduate medical education is what makes people stay in Georgia. So where you do your residencies, where a lot of times where you end up staying. So that's super important. I'm a little confused about the medical examiner thing. I'm very familiar with the problem because GBI is so overwhelmed and has been for a long time. And I think we did something on that in the amended in GBI's part of the budget, if I'm correct. And it's an important conversation. How we can grow some of those people here is going to be a good topic to discuss.
Yeah, and I think, if you put that in one of your to-dos, that would be helpful. I agree that, right now, again, that's not our budget, but, we're having a hard time keeping those folks in Georgia. A lot of it's because of the competition. There are just not many of them, and we do need to come up with some sort of long-term plan of how do we get more of those to be trained in Georgia, and perhaps some sort of potential, whether it's a scholarship or loan repayment or something, so that we can incentivize those specifically. So we'll take that conversation offline, but
Okay.
but just know that's something I think the subcommittee is interested in, because otherwise it's just we're going to be competing with the rest of the world for these few docs, and I think it's just going to cost us a lot more. If we can grow our own, I think it'll be a lot better use of the taxpayers' dollars. The other thing I had a quick question about is the increased residencies. I mean, we definitely want to do that, and I know we funded some new residency, some startup grants in the past.
Yes.
Are those folks in touch with you guys, letting you know, or is most of the time that coming just through the interested legislators that kind of from that area that bring it to the appropriations attention?
So we actually reach out to all of the programs and ask. This is Freeman, our budget director. Montague, he's our budget director. We actually reach out to the programs every 6 months to see where they are. If they're, we have a lot of programs that are new, that are growing and trying to get started and may not have made the accreditation by the time the match started. So we reach out twice a year, and that's how we come up. This is we have a sheet of what they tell us they're going to do for the programs, and then we change it and revise it during the year until it's time to present it here.
So, and again, I'm not picking on them, but just for example, because it's a new one in our budget, is the program they're talking about in Brunswick. Do y'all have any information on them at this
No.
point?
No.
So they don't have a current residency, so this is truly brand new.
Right.
Okay. I thought it was, but I wasn't 100% sure. Anybody else have any questions? Yes. Let me see where you are with your microphone.
Whatever that little number says, is it 14 or?
9. You're
I'm sorry,
9.
we renumbered.
You're good.
Thank you. If we could, you talked about a great number of nurse practitioners that were turned down. If you could, where does that money come from? What limits the amount in it? What does it take to get more in it? I mean, that's just some real basic questions about structurally how you get in the posture of having to turn people down that want to apply for, is it grants or loans?
It's a loan repayment.
Loan repayment.
Mhm. So 98, I think is this Physicians for Rural Areas, 98.100 is our loan
Right.
repayment programs. So we're funded, it was a line item to add APRNs and PAs maybe 3 or 4 years back. And so that was our most recent loan repayment. So it's funding put in $100,000, I think, for each one. It was $200,000, so we made it $100,000 for each. And so the board is now looking at how we structure the loan repayments. Generally, we offered renewals to everybody. If you were in the program, you got a renewal automatically. You were ranked in the renewals. And then as new people came on, for nurses for sure, their debt is around $40,000. So they get the opportunity to have $10,000 a year up to 4 years. Generally, because most of the people that applied were already in practice, so they may have needed $12,000, $14,000. So it turns over faster for nurses and PAs because the program is so new. So it's the reason we only have so many is because of the amount that we have. And I will say this about the nurses, to their credit, they do a lot of advertising. They're a big, powerful lobby about telling other nurses about what's happening. So when they're out talking in their groups, I mean, we are bombarded with their applications because they advertise for us. We don't have a way to really let people know about the programs. We try to reach out to people through the schools and groups, but the nurses do a very good job for that. So that's why we have so many.
And we have the need for those nurses in rural Georgia?
Well, I think
Advanced practice nurses?
that's a good question, and I think that the schools are producing, and I'm speaking from my experience at home. The schools are producing so many. We had a opening in one of our practices for a nurse practitioner. It was a women's health office, and we had 25 applications for that role in our small county. So, I think we need to be careful. Part of this is workforce solutions, and at least in our part of the country, nurse practitioners there is no shortage. We have a lot of nurses that are not using their degree because there are not enough jobs for them. So, I think we've done a good job with that area, and so I personally don't think we need to increase the number of scholarships because we've got plenty of them that are doing it now and are doing okay. We have a shortage of nurses, RNs. We don't have a shortage in the nurse practitioners right now in Georgia.
And you're comfortable expanding that from your region's experience to all of rural Georgia? I mean, when you talk about what you think is the trend line.
Yeah, I think so. I've not heard, again, I've had this budget a long time, I've not heard a lot of people saying, well, we're having problems finding these people. We need to have some incentives, like what we're talking about with the medical examiner. We know those are a problem. And, if I do think that and I know there's several groups working on the nursing shortage right now, trying to come up with recommendations for us.
For the RNs.
For the RNs, what do we need to do to get more of those? Because that is a definite need. I think hospital associations back there, I think they would nod their head. That's probably their number one issue right now is RN shortage across the state. So, that is widespread. But I don't think, at least right now, I'm hearing from NPs and PAs that we're having a super shortage of those. And
so that's probably, as that profession is growing, impacting, it's a pathway from beyond an RN, and people are taking that pathway clearly.
That's right. 10 years ago, this conversation was different, but right now that we've done a good job, and we've got a lot of those folks out there that are, like I said, they're not even able to find opportunities. Even in small towns, some of them are just waiting for somebody to retire so they can take their job.
And so, if Mr. Chair, and I'll direct this to you, how do we determine shortages, the presence of shortages systematically? Where's that? Who's doing that data?
I'll let LaShawn answer that question because I know they do a lot of surveys and so forth. So.
Right. So we're now doing the nursing data. We have a data visualization site on our website. And so you could look and see where the nurses are located, LPNs, RNs, and APRNs. So if you search the site, it goes county by county. So we're very thankful to the Nursing Board and the Nurse Leadership Coalition for sharing that data with us so we can produce that. So same things for PAs, dentists, and physicians. So we have that.
So who's doing the thinking about how to address the nursing shortage? What do we come up with on the nursing shortage?
Well, I know I've asked our AHEC to do the work right now, and they started last year. COVID kind of has slowed that process down, but I think they've got a very, very robust group of statewide stakeholders together working on what we need to do to try to address that. So I was expecting that before this session, but because of COVID, they weren't able to meet like they needed to. So it'll be next session before we get their recommendations. So I'll just say I'm working on it now. Whether or not anybody else is working on it, I don't know. Yes.
Yeah, another thing is we did have a change in the director of the Board of Nursing this year, and she's very new, and that would be a good thing for her to be involved in that conversation also.
Yeah, I would say they're involved. We're invited them because they really tried to do a good job of inviting the right people to the table. And they're having meetings, I think, even now, they're having Zoom calls and trying to get everybody to the table and get the best ideas of what it is we need to do to address that. I mean, hopefully some of it will be short-term and some will be long-term, but it'll, you know, hopefully we'll have some answers, because we got a big problem.
Thank you for that.
With them. We are going to adjourn. I think we've done what we needed to do today. Appreciate everybody's attention, and thanks, LaShawn. We didn't get to talk about the composite board, but we'll save that for another time.
Okay, thank you.
All righty. Thank y'all. This meeting's adjourned.